Dr. Lavinia, India, now we are like the most populous country in the world. And you would think that it is so fertile that we are all growing so many babies and things. Is there a problem with fertility in the country?
Definitely, yes. I do agree that India is a very populous country. But then we're looking at people who already have children. But then there is unfortunately a lot of couple who want to conceive and they're having a trouble conceiving. Sometimes I fear telling my peers in other countries that I'm a fertility specialist. Forget other countries, my own friends from different specialities. When I say I'm a fertility specialist, they're like, why are you populating the country so much? I'm like, hello, we are talking and trying to help people who do not even have one child. And through my career of gynecology, I started seeing a lot of patients who were going through a lot of fertility issues, having trouble in fertility. And especially, I think the emotional trauma that they were going through. And when I say emotional trauma, I would say it's more of the females going through the emotional trauma. It took a lot of time for me to make the couple understand that it was not just the female's problem. And quite a bit of people, not just India, across the world, still need to understand it is fertility doesn't mean it is just a female factor which is having a trouble. Equally, there are male partners responsible for fertility and they do have fertility issues. In fact, over these 2 decades of my practice, I'm seeing more of male factors being a contribution to the infertility than the female factor. So if you want me to tell you in terms of numbers, I would always say 30% contributing to just the female factor being a problem, 30% male factor, 30% is like both of them. Unfortunately, we have 10% like unexplained. So we do not know the cause. All the investigations turn out to be normal. The semen parameters are normal. Blood parameters of the females normal. They're ovulating, still they don't conceive. So we put them in the category of unexplained. So this is the issue. So we have at least 15 to 20% of our own population, what you're calling as a populated country, we still have 15 to 20% of the people going through fertility issues.
To define, what is a fertility issue? When do you call it this couple has a fertility problem?
Very interesting question, I would say. Fertility, we say you are an infertile couple. That means if you've not used any contraception, that means an unprotected sexual contact for almost a year and you cannot become pregnant. That is when we label you as an infertility couple. But then to this, there is an age factor. So we are seeing ourselves now how the marriageable age for a female is increasing. Initially, roughly, girls got married around 20, 25 years. Now at 35, I have girls coming and saying, I want to plan pregnancy at another couple of years later, or I want to get married in a couple of years from there. So the infertility definition also changes. So we say 1 year for anybody who's under 35. Now, if you're above 35, we don't wait for a year. We say only 6 months. So now if you're 40 plus, because we have a lot of people getting married at 40 or getting married earlier, push their pregnancy plan because of their career and a lot of things. For them, we say now, the day you walk into the OPD, that is when the evaluation starts. So this is what is fertility as a definition, if you ask me.
So when a couple comes to you with this fertility issue that they've tried for a year and it's not working, what happens? How does their journey go? How do you take them through?
What I feel is communication becomes a very important tool for our fertility patients. And communication is something very important for a doctor, not just as a fertility specialist. I think if we really hear out to our patients, half the diagnosis or almost the diagnosis is done. And we need to use the other tools just to make sure what we have diagnosed is right or wrong, or it could help in a treatment modality. So we talk to them of when they were married, and I'm seeing a lot of couple being sexually active before marriage, going through a lot of abortions, or even for their career reasons, they've conceived and they don't decide to continue the pregnancy. They go through terminations. not a proper knowledge on contraception. A lot of these things also inhibit them from conceiving later part because it would have infected the uterus or the tubes can get blocked. Other than this, like when I said women are also postponing their marriageable age, they are getting career oriented. I feel that is good. Women are getting empowered. But then we need to understand that our biological age is something different and our aspirations are something different. I think we need to learn to balance this because for a girl, she would have anywhere around 1.5 to 2 lakhs of oocytes, that is the eggs in her body. When she's attaining a puberty, it would have already dropped down to 30 to 40,000. So that means the atresia is coming down, is happening so fast, the eggs are crashing. And of this 30, 40,000 eggs, only 400 gets released in our entire lifetime. And initially, all the good eggs gets exhausted. It's like how we have crate of an egg or any food. We want to use the good ones first. So that's what the body also goes through. So the good eggs gets released earlier. And this is why lesser complications at younger age when you plan pregnancy. Unfortunately, because women are postponing their age, if you're planning about 30 or 35, what happens? The quality of the eggs would have come down. And of the 400, already 200, 300 has got exhausted and you are left with 50 to 100 and not so good ones. So that is when they end up having issues with conception. Also with the increased age, they have Down syndrome. That means mental retardation for a child is quite common. So this is why when women come to me, I always say, yes, of course, I'm also a professional. So I would encourage every woman to be financially independent, do what they like, and they should have a career for themselves. But then you also have to manage this. And this is why I said balancing your biological age is very important. So I always say, conceive, give it to your amma, atte, whoever is there at home, and you continue to do your career. And even for myself, personal experience as well, I will always say children are never going to hinder your career. So your children will always be a support for your career, and I don't think any child would hinder a mother's career. So it's what you want to do. Your determination is what matters. So conceive at the right time so you have lesser problems in terms of fertility issues, good quality of eggs, and your chances of conceiving becomes much better. And we're also seeing, I think it's because we're getting exposed to a lot of pollution in the environment, the food that we're eating, we're getting exposed to hormones in the poultry, not just the poultry, even in our vegetables. I think there are a lot of hormones going because they want a particular shiny color or a bright color to the vegetables. A lot of injections, a lot of chemicals are going and we are ingesting inevitably. So this is all causing a lot of gene mutations, and we are seeing the AMH. AMH is an anti-Mullerian hormone, which we indirectly assess to see the quality of the eggs. Of course, just that as a parameter is not going to work. We're going to add a lot of things like FSH and a lot of other parameters. We're going to use tools like ultrasound to see what is the reserve, what is the age, what kind of treatment do we need. And simultaneously, while we're evaluating the couple, we also, when we say couple, it's like both the female and the male partner as well. So we do ask for investigations for them. We also do a semen analysis, and we are seeing a dramatic difference in the semen parameters. Could be because of the mobiles going in the pocket, and it is proven with a lot of journals that it causes a lot of sperm inhibitions, the morphology is changing, the sperm motility is changing, and a lot of sperm factors are becoming a contribution for these fertility patients. So we start from, like I say, I always love preventive health. So we start talking to them about how a lifestyle changes. Simple thing. We call it as a laptop. Doesn't mean you're going to put it on the lap and start working. And this is what I think the COVID negative thing, like work from home culture has started. So we see couple working from home. So what happens? You're not going to be sitting on that desk forever for your 8 hours of 9 hours. You end up shifting places from your hall to bedroom to your kitchen to your dining, and I think you end up with your relaxed legs up in your hall, and then the laptop goes on your lap. And these heat waves are causing a lot of issues to the reproductive area. and they are causing a lot of issues. And yes, these are simple things. We tell them simple things like avoid hot showers, avoid tight undergarments for both male and female, because it does make a lot of changes in the temperature, and this is how it is going to impact a lot. And like I said, quite a few times, 30%, like I mentioned, we have problems with the female, we have the problems with the male. So that becomes a little challenging. So I think, again, trying to make them understand what is the treatment modality that we need to. Sometimes very little help they would need. So we can just put them on some medications. Of course, scan is something very important. What typically happens, we try to treat them on the second or the third day of their periods. We do a simple scan to make sure the uterus is normal, the ovaries are good, everything is fine. So we start. It's very simple. Young couple we have, and you won't believe, so many times we've had incidences. They don't even know the right way of a sexual contact. Because nobody's ever spoken to them, or they're exploring it in a different way. So I think that simple lack of knowledge of just a proper sexual contact, and when do you have a sexual contact to become pregnant, is also lacking. So we start from there. So we tell them there's something called as a fertile period. I've had couples who think you should be having a sexual contact during periods, and that is what is going to make you pregnant. So we ask simple questions like, are you aware of a fertile period? When do you have contact? So we start from simple things like that. We tell them, when the day you start your periods is day 1. So roughly, if you have a 28 or a 30-day period, we say anywhere between 10 and 20th day, when you have a contact on alternative days, the chances of conception increases, because egg is not like a clock. It would tick on the 14th day and release an egg. Because once the egg gets released, it is alive only for 12 to 18 hours. That is when the sperm needs to reach out. The sperm is a good quality. It would survive for like 72 hours. Again, if the quality is not good, for 24 to 48 hours. So this is what the simple talking will help them understand. And we have quite a good number of patients who conceive naturally in 1 or 2 months, and I get to take the credit and say, you've been a lucky doctor for us. So I feel, doesn't mean I'm a fertility specialist. Everybody who walks into my OPD, I'm going to do an IVF for them. So I spend quite a lot of time with them, sit with them, try to understand. I feel as a care provider, we need to be approachable for a patient. If I don't talk about their sexual contact or their personal life, their bedroom conversation, if I'm not going to make it, who would they go and talk to?
True.
And making them feel comfortable to talk about their personal life, I think, is very important. That is when they open up. That is when they come back and say either they have a problem with penetration, or the wife is not cooperative. We have sometimes a pathology called as vaginismus, where the vagina is very tight. It's painful. Quite a lot of it is a psychological issue. So we need to talk to the partner as well. So sometimes we try to do a couple counseling. Sometimes we have to talk individually. Of course, we can't help. There are medications to relieve the vaginal spasm, and we work towards that. So this is why my cosmetic gynecology works, and then we help them with the vaginismus, the tight vaginas. We have injections where we relax the muscles. So a lot of things happen. So simple treatment like this, when you talk to them, you understand what is the problem, you treat. Quite a few of them conceive naturally. Of course, unfortunately, quite a few people would need a treatment. But when we say treatment, doesn't mean we have to jump for an IVF. Carefully evaluating, and I always give my patients a good option. Trying to say, look, you take a tablet, your conception chance is something like 8 to 10%. Then you do an IUI. If there's a male factor, so there's a problem with either having a sexual contact, or like I mentioned, the sperm needs to run and get fertilized with the eggs in that 12 to 18 hours. Not possible. We take the semen, wash it, take the good sperms and put it into the uterus. So you're reducing the distance from the vagina to the uterus. So that is how the sperms reach much earlier. And this itself will increase their chance of conception by another 10 to 15%, I would say. So roughly between 20-25%, which is good. Quite a few conceive with that. Sometimes we'll have to go extra step, try to evaluate if the tubes are open or not. We have various modalities. And I mentioned that the AMH, the anti-Mullerian hormones, are reducing. FSH is becoming high. Doesn't mean I would jump and do an IVF. Even then, we give them an option. And a lot of times, just with few nutraceuticals, we see a lot of patients conceive. And I think for fertility patients, stress is one of the main factor. Stress, one, that they are not conceiving. And I think the major stress is coming from the surrounding.
Society.
Yes. And I feel really sorry because when the couple come back and say, I've not gone to my mom's house or I've not attended a social gathering from the last 1 year because I have friends and family coming and asking me, Inna pregnant agilva, Inna enu agilva and all. So they feel it's a social obligation and they refrain. And human beings are social people. And once you cut yourself off from your social gatherings, you're just inside your own surrounding and you have nothing but every morning you wake up to the trauma that you don't have a child, and in the night you end up having a fight and there is no proper sexual contact, or the husband's trying to avoid the partner or either of the partners though, and you're actually split. Couple come back and tell me, last contact, I had a couple yesterday. She was telling me, Madam, our last contact was 6-7 months. I'm like, what do you expect me to do? So simple thing, the husband is like, Madi madam neevane. It's like that. So they're not involved. So when you talk to them separately, you understand what is the issue. Either the husband's complaining about the wife about nagging or a weight issue or something else, and the wife has a problem with something else. So when you talk, you try to understand the problem separately. You try to keep them together and talk. Quite a few people conceive and things go well for them. I would say around 30% of these patients will end up going for a higher modality of an IVF or an ICSI when the male factor is too much, or we have tried couple of natural methods or an IUI, they don't conceive, then we end up doing IVF for these patients.
If we split these factors into male factor, female factor, obviously both sides or in both cohorts, you have this stress and things which is an external thing and internal,
correct,
probably structural problems as well. So if you take it one by one, coming to female fertility issues, other than the stress and the environmental factors, what physical conditions causes this infertility that they have to be aware of?
I would say commonly is a polycystic ovary. So nearly around 30% of our patients end up having PCO, we call it. So this polycystic ovary itself has got in because there's a lot of gene mutations which happens. Like I said, a lot of food that we take. It's also a genetic factor. The mutations of the gene happens and the child ends up being PCO. This is why I say we need to focus not when they come to you at a reproductive age group, but target them early and target them at their adolescent. PCOS is something that you diagnose when you're an adolescent. Either you have an obese child, you have irregular periods. Of course not, I'm not talking about kids as young as 13 or 16, 17 years, much later around 18, 19 years. It is important to address your lifestyle. And I think in India we always say, "Chanagide, gungundu we are very happy with a child being a little chubby. So, but I think that is when we need to inculcate the habits of a healthy eating, workout importance, and the kind of lifestyle that you lead, personal hygiene, contraception, everything plays a role. If not addressed, they don't realize what is the importance of a workout. For a PCO, once you're a PCO, you're a PCO. I've had a lot of patients who run from doctors to doctors, pillars to posts, trying to say, Nenne scanal PCO irlila madam, ivatidya. So it's not going to change. It's like an organ of yours. So it's not going to look different when you do a scan a month later or 6 months later, or it's not something that it goes away with the medicine. So this is something which is treatable only by lifestyle, and that is your first modality of treatment. So where you have a PCO patient has irregular periods, sometimes they don't get periods for 3 to 6 months. They have a lot of hair growth on their face. Their neck region starts becoming more darker. This leads into more depression. This leads, once the depression sets in, your food habits are changing. So again, you put on more weight. So that becomes a vicious cycle. And that itself is going to be a lot of stress. Again, stress alters all your hormones. So this vicious cycle goes on and on and on. And
correct.
I feel that is one of the major problems that we've had, because I think a patient comes, they know what the issue is, because quite a few times I'm not their first doctor. I've realized, even for myself, I think I understand losing weight is not something very easy. So somebody walks in and I say, hey, you need to lose weight. I know for the next day she's going to disappear, going to go only see another doctor. So I've changed my way of approach. So I'm going to start by talking about everything else just other than the weight. Then we say, can we start working out this way, like 10 minutes of exercise? Like I said, I'm also not an exercise person. So I understand how difficult is it for a younger people. It could be even a 19-20-year-old girl or somebody coming looking for a pregnancy, and we tell them you have to do 1 hour exercise. Who in the world has 1 hour time to do an exercise? Unless you are motivated. Of course, that is what is needed. But how many of them are going to be dedicated? So you'll have to start talking their language. Just start trying to tell them, make smaller changes in your dietary habits. Start cutting down your junk. Like, I will ask them, how much pani puri do you eat? How much bel puri do you eat? They're like, oh, then if the mothers are there with them or the mother-in-laws, ಎಲ್ಲ ದಿನ ಹಿಂಗೆ ತಿಂತಾಳೆ ಪ್ರತಿ ಭಾನುವಾರ ಹೊರಗಡೆನೆ. So this is how they start talking about it. So once I feel that mothers are nag, you should see that patient looking at that mother or the mother-in-law, and that is like, I'm like, I too. So you have to maintain that harmony as well in your OPD, and it's not just the mother-in-law and the patient, it's quite a lot of the couples also fighting in the OPD. So I think maintaining that harmony becomes very difficult. So sometimes I feel it's like I'm an advocate. So I'm trying to solve their problem, or a family member I become for them. So we start addressing these things, and I say, I tu tinni, but then you start eating half a plate. Take your partner or take your friend and you share
it.
And now you know the fast food joints that we have and everything with the Swiggy, Zomato coming in, it's like everything you get it at the end of the tip of your finger. So even I say, burger, you love burgers, pizzas, because the mothers will come, and I have patients, like I said, even the lower class or even this thing, they say, our dina pizza, dina burger, college in the banmel hing keltale, and this is what is leading into obesity and having problems later. So I start telling them, you cut. So you can't stop overnight. Even if you stop, your taste buds are going to crave it for it. So a week later, you're only going to go end up eating that entire pizza or ordering 2 more burgers, and this is what you're going to end up. So I'll start saying, cut down. And I think once they start seeing that weight loss themselves, you don't need anybody to tell them. It's
They'll
just
get self-motivated, isn't it? It's the push that they need.
Yes, definitely.
Absolutely.
And once you start looking good, and I try to give the generous compliments to the patients, and they feel happy, that's motivating for them. And I think you'll have to also talk to the partner and tell them to be generous with their compliments, because I think any wife or any husband would expect a compliment from them. Simple things. I think these are all small gestures that we start talking to them makes a lot of difference in their own life, and simple things like this would sort a lot of things.
Absolutely. So PCOS is one thing. What other structural things can cause?
So if it comes to structural, so many things we end up seeing. Somehow over years, I'm not sure, it's just that the diagnostic modalities have become better, because we've had wonderful scan machines which picks up quite a few things, and not necessarily everything that it picks up it has to be treated. We also have to practice very ethically, trying to say, look, this needs a conservative management and this needs a surgery. I think it's individuals' ethical practice which is very important. Because of the advent of advanced scanning, we've been able to pick up a lot of uterine abnormalities these days. We have something called as a septum uterus, where you have a line coming from the uterus, and if this is there, the people cannot conceive, or they conceive, they're going to end up having a lot of these abortions. So these could be a problem. They could be having a polyp where there's a growth and it prevents people from getting pregnant. When there's a polyp, it itself acts like a contraception, because it's just sitting there in the
like
cavity. Yes. So the uterus senses already something. Why would I need to receive a baby? So it rejects, and the baby is not going to get implanted. So these are all just picked up with simple ultrasound, and scanning machines have become very well. We have 3D scans, we have 4D scans, where you pick up every small structural abnormality. So uterine anomalies can be addressed. So these are one of the problems that helps us solve. And sometimes physical examination of the patient itself. We know how cooperative the wife is. Is their sexual contact good? Because they may be like, we have no issues and all. But then when you examine, she's not letting you examine. So then I know there is no penetrative sex happening. There is just a masturbation happening outside the vagina. So we diagnose a lot just by examining the patient. And we see quite a lot of times there's a septum in the vagina. These all need a physical addressing, so that they need a physical, they need a surgery, I would say, to solve these pathologies. And through the scan, we diagnose endometriosis, where there's a blood collected in the ovary and it sits there for a long time. And these inhibit the quality of the eggs. So the quality of the eggs come down. So this is why they suffer from conceiving and they have a problem conceiving. And endometriosis is literally like cancer, I would say, because these patients end up having a lot of painful periods. I have young people coming as young as 30, 32 and saying, forget pregnancy, you get my uterus out and I'll be happy, because they have pain during periods. So it's very important for me to speak their language and try to make them understand this endometriosis is not from the uterus. It's from the ovaries, where the blood is collected in the ovary, and me removing a uterus is not going to solve a problem. So simple things. I have uterus, tubes and ovaries. So when you try to explain what it is, so they understand. And I think people are quite receptive to receiving information. They understand what it is. And now I think the education is available. The Google doctors are there. A lot of information is out. I will not deny, or I wouldn't say that is bad. I always tell my patients, use Google for your knowledge, but not to treat yourself or go by what that is, because your doctor is going to make a tailor-made treatment for you. Google, whether I Google, he Googles, anybody in the world Googles, that is the standard information. So use it as an information. See your doctor, they're going to tailor-make just for you.